Family First Health is an independent private nonprofit serving York and Adams County.
We're a community-driven healthcare provider seeking to improve the health of those who are most vulnerable in our community.
Whether that's a family that has private insurance, limited financial means, or a family that has no financial means.
They put your health first, and they really do care.
We have various different departments. We have medical, dental, social services.
We're also able to provide supportive services to people with a variety of chronic illnesses to help them manage their illness outside of the doctor's office.
They're very helpful. They're bilingual. They're there 24/7, even if they're not open.
The different services that they provide impacts the entire community.
We started in 1970 with a few folks with medical backgrounds who saw a need and a gap in the community. And those individuals had a vision of a health center. Throughout the years, we'd evolved from one small health center to now a 5-site health center.
Family First Health has been around for so long because there is a need.
People like us need places like this to go to, not just because they have a financial way of helping you, but because the quality of care.
We tailor our services to the unique needs of each community, and I believe we're really good at assessing community need and developing healthcare services to meet those needs. One of those is Nurse-Family Partnership, where we're able to really significantly impact the lives of young families.
Nurse-Family Partnership is a nurse home visitation program for first-time moms. They are partnered with a specially trained nurse during pregnancy.
And what's unique is that we don't just see them during pregnancy, we see them until the infant is 2 years old.
We help them with lots of parenting skills, how to bond with the child, simple interaction, what to look for developmentally in their child.
It doesn't just benefit the mother, it benefits the baby because she is educated before she even has the baby.
It really helped us out a lot because, like everything was just there before she even came out, So we was pretty much like prepared for whatever was coming up.
We can have upwards of 50 visits with these families, which allows for a lot of change and a lot of education to happen.
And ideally, we'll get the child and the mother in her prenatal stage in our dental program as well as the medical care, because good oral health is necessary to the health of the mother and it can impact the unborn child. We're able to dramatically increase their health as well as their own self-confidence and appearance. By saving a smile, you can really save a life.
To have Family First in our community is a gift to keep our community strong.
A lot of our patients don't have a medical home, and if it weren't for us, they would have nowhere to go.
Not being able to have a medical home, the medically underserved people have gone to the emergency room, and it has taxed our hospital.
As more and more people see this as a primary care facility, that will help to meet most of their acute and chronic needs, but also will relieve the emergency rooms of all the hospitals.
Without this organization, without medical, without dental, without social services, a lot of families would go without care.
It's more than just having a doctor. If you know that somebody cares, it just gives you confidence to ask for help when you really need it.
Family First focuses on getting people into care, getting them the right care, so that they can get healthier quicker.
This is the first program I've worked where I can say that there's so much hope.
I am honored to work for this organization. I think it provides a true need in the community.
And people that really care enough to support it, it takes that. You have to have support.
A lot of times we have the manpower, we have the facilities, we have the talent to provide the care, but what we may lack is funds.
To take away their medical and their dental that is literally in their backyard just would be a travesty.
You would have a very large chunk of the community that wasn't serviced, and I mean a huge part.
I thank them every day for that special time that they take, the extra hours, the extra phone call.
The rewards are just immense to see these young families succeed.
A donation would change a lot of people's lives.
I just really appreciate what they do for me and my family, and I do thank them a lot.